That's what all right. So I'm with Somi Javid, Dr. Somi Javid, I should say, and I'm Sally Miller. And Dr. Javid, I'd love for you to introduce yourself and talk about HerMD, this incredible company that you have started, and just what led you to create HerMD.
Hi, thank you so much for that welcome. I'm so excited to be doing this with you. As always, love working with you. I'm Somi Javed. I'm a board certified OBGYN. I'm CEO and founder of HerMD. We are a GYN practice and company specializing in sexual health and menopause. We're on a mission currently to open 15 centers around the country, thanks to a very successful fundraising round this summer, and expanding our services to all 50 telehealth states by 2023. And why I went into women's health care and specifically menopause and sexual health is actually a very personal story. When I was pre med at the age of 21, my mother, at my age now, 46, nearly died of undiagnosed cardiovascular disease. And it's a typical female story. It wasn't because she wasn't asking for help. It wasn't because she didn't have insurance or access. She had all of those things, but she was currently continually denied by her physicians and dismissed, despite the fact that she had chest pain, left arm pain, shortness of breath. And finally, after 6 weeks of begging and pleading for help, she actually coded on the cardiac cath table and had to go emergent quadruple bypass surgery because science and data at the time could not explain why this young, otherwise healthy woman would ever present with four vessel disease. And for me, it was a very personal aha moment. I'm a doer, a problem solver, and I was like, this is it. I'm going to go into women's healthcare. Like, we need an advocate. Um, Medical school, residency, pretty typical career path, and then got my first job. And we both know that the healthcare system is really broken, and especially for women, it's broken,
Right,
right?
absolutely.
And so I'm seeing 50 patients a day trying to be an advocate, and I don't have time to eat or go to the bathroom, let alone keep that promise I had made to a very young version of myself. So, just shy of my 40th birthday, bought a building, opened a practice, and we are currently in two states, in Ohio and Kentucky. And by year 5, we had attracted women from over 30 states. And I knew I was onto something.
Right, absolutely.
Got some partners, and that's where the HerMD mission started.
Oh, that's great. Well, and we so appreciate at Woman S, my company, all of your partnership. You've just been an amazing partner in, helping to share the mission that we're both on to really change the conversation about menopause and women's health and just educate and inspire women, but also bring men into the conversation too. Let's face it, men really want to also be educated about women's health. And the topic that we're going to cover today about sexual health, sexual wellness is affects both genders, right? And so we're going to touch on that a little bit. But just to introduce myself, I'm this, as I said, I'm the CEO and co-founder of Woman S, which is a new menopause brand, taking a modern approach. We believe in sparking what we call menopositivity through products, inspiration, and information. So Dr. Javid has been working with us on really, I would say, both inspiration and information, those two important pieces of our brand. So it's such an honor to be here today with you. So I wanted to get back into, a little bit more about your specialty, which is sexual health. So I'd love to have you just even expound on, the difference between sexual health and even sexual wellness.
Yeah, so it's very interesting. People are like, what is sexual health? What does that even mean? Well, it's
Right.
different things to different people, as sexuality and intimacy means different things. But sexual health providers, we focus on taking care of sexual health problems that can happen for women or men. I specifically, as a GYN sexual health provider, take care of female patients, but
Right.
their partners are always welcome to their visits, and they can talk about what's happening in the relationship. And so we want to support and empower our patients to become partners in their healthcare and talk about things like low sexual desire, sexual pain, arousal problems. People are like, what's arousal? So, desire or libido is the intent to have an intimate encounter. Arousal are those physical changes that happen, the increased heart rate, the sweating, you know, when your body and your mind are in tune. And some women have a problem with arousal.
Mhm.
Orgasm disorder. Some women can't have orgasm, or it's painful, or it's markedly delayed. It used to happen a lot sooner. There's already an orgasm gap between men and women. We tend to orgasm a lot more quickly on our own. Takes us a little bit longer with a partner. And our goal is to make sure that sexual intercourse is pain-free, mutually satisfying experience for our patients and their partners, and helping them to achieve whatever goals they have, whether it's I need my libido to be back where it was before menopause, or back
Mhm.
where it was before I fought and conquered my cancer. And so that is truly what sexual health providers do.
And what is the first step that someone should take? That just feels like, like in my experience, that was why I started Womaness, was because I knew I was in menopause, but I didn't realize that the symptoms I was experiencing were related to menopause. And my symptoms were painful sex and, everything dries up, including your vagina wall. So I would, obviously, we're this affects people that are well into menopause and postmenopausal. So what are the first steps that people should do just to get a little bit more educated
Yeah.
themselves?
And I think, providers, we need to own it. We have not done a great job educating female patients about their anatomy, about menopause, about
Hmm.
sexuality. So get educated, and if you're not comfortable yet making that appointment with a provider, websites like yours, like Womeness, like mine, Her MD, there are a lot of femtech, women's sexual health care, and menopause companies that are popping up that have a wealth of free knowledge. One of my really good friends, Dr. Lindsay Harper, designed an app. It's called Rosie. So there are a lot of places to get good sound information.
Hmm.
Talk to a girlfriend who's been through it that's trusted, or a sister, or so make those connections so you don't feel alone, you don't feel isolated. Talk to your partner if you're there,
Hmm.
and when you're ready, talk to a provider. And so there are two great organizations, NAMS, North American Menopause Society, which will help you put in your zip code and find a provider. So that person is not going to dismiss you. That person is well versed in menopause and is trained in all those additional courses we need to truly be good, effective listeners and providers when it comes to menopause. And the same thing exists for sexual health care providers. If you're truly looking for a physician who will listen, who understands sexual health, because not
Hmm.
all of them do. In
Right, right,
fact, the majority of OBGYNs are not trained in sexual health.
right.
ISHWISH, the International Society for the Study of Women's Sexual Health.
Mm.
They also have a locator button for find a provider. So if you're having problems specifically with sexual wellness, you can find a provider who specializes in that.
Wow, that's great. Two good places to reach out to, right?
Absolutely.
That's really helpful. And we can make sure that that's included in the chat, um, with the right, link to their site. So no one will find a dead end. They'll definitely get some help, right?
Because
So what
sometimes,
else? Go
yeah,
ahead.
that's sometimes the biggest problem is that, when they get to me, I'm like their eighth or ninth provider.
Yeah,
So we
right.
can, stop that delay in care by providing those links. That's one more step in doing what you and I love, getting
Right.
people the right solutions for them, right?
Yeah, absolutely. And I think the longer it goes on and the more money you spend trying to get to the bottom of the problem, you get so frustrated, which does not help with the libido situation, right?
Not
The
at all.
longer it goes on, the worse it maybe gets. So, um, So what else do, some of your patients come to you with? What other, problems or, even any success stories that you've had?
Yeah, so, most of the problems, so you know this, and I know this, menopause can affect women from head to toe,
Right,
right?
right.
So, whether it's complaints of word finding or cognitive decline, like I can't remember what I was supposed to say at the board meeting, or why I walked in the pantry, or why am I gaining weight, or why do I have no sex drive, or why is my vagina dry, and why does it hurt now when I have sex, or even when he touches me? So these are all the complaints that I get. I also see some rare conditions like vaginismus, where
Mhm.
sexual intercourse can actually be impossible due to too much tone in the pelvic floor. I have so many success stories. I have women from around the country who were never able to have intercourse, and with the right intervention and medications and counseling, they're now able to be sexually active.
Wow, that's great.
Um, yeah, no, and I mean, and I also see the devastating stories. I see, patients who were thrown into menopause, had no
Mhm,
idea it would affect things negatively in the bedroom, didn't even know where to look, and lost their marriages or their partners who were
mhm.
had no patience for that.
Right,
And
right,
because they took it as a rejection, right? And that's why, like you said, it's so important for the partners to be involved. They didn't understand that what was happening was hormonal and physical, right?
yeah,
I want to be intimate, but it hurts. So that's why I can't do it. And so heartbreaking stories of patients who have lost relationships and then
mhm.
their self-esteem and their mental
Right,
health,
right.
right? And so
Absolutely. That's why this is an important topic, and it's not selfish. It's very important.
oh, no, agreed. And so when we explain to them that menopause can affect them from head to toe and also can impede things in the bedroom, and then we talk about solutions that are available over the counter like Women-S, we talk about hormones, we talk about other medications, we talk about lasers and radio frequency that can
Mhm.
actually help with those thinning vaginal walls that can lead to not only painful sex, but recurrent vaginal infections and sometimes incontinence, right?
Mhm. Right,
And the whole syndrome is actually called genitourinary syndrome of menopause because that loss of estrogen leads to a loss of elasticity and anatomy changes with both the bladder and the vagina. So you have this whole host of symptoms. Like patients come and they're like, Dr. Javaid, I'm having bladder infections like I did when I first got married. It's like honeymoon cystitis again. And it's
right.
that, but it's now caused from a different animal, right? It's from this change in anatomy that we're experiencing that if we're all lucky to live long enough, we will all go through menopause. So I love what you guys say, the after party. We call it a new dawn. There are things
Yeah.
that you can do, whether it's prescription medication, whether it's hormones, whether it's over the counter, products. There are definitely things that you can do to help promote sexual wellness, but also menopause wellness.
Yeah, absolutely. And I was going to ask you a little bit more about what kind of products are out there. Obviously, I can tout my own products. So we have a vaginal moisturizer called the Daily Be Soothe. You can buy it at Target, Amazon, and womaness.com. And it's a very clean formulation. It has hyaluronic acid in it. It's water-based, but the hyaluronic acid is for extra moisturization, hydration, which is so important. We do have a vibrator that is selling very well at Target on the shelves. It's on target.com as well as womaness.com and Amazon. Um, we try to have all of our products, available on target.com as well as amazon.com. So those are kind of two main, sexual wellness products, but we do have more coming out just because there's such a demand for, very, I would say, discreet products. Like in the case of our vibrator, it looks like a lipstick. So it's very discreet and very safe products. I don't think most people want, products that have any sense or, anything too additive, right? They want it very clean, very stripped down so that there isn't any chance of any sort of infection. So we've been
Yeah,
very careful.
Agreed. 20 years of listening to patients in rooms, you really get to hear what women like, what they don't like, what's
Right, right,
irritating, and what's not. And so, yes, those are the kind of products I recommend.
right.
Clean, unscented, things that will last a little bit longer. Because, like you alluded to, the
Yeah,
water-based is great because it's clean, but you need something else for it to last a little bit longer.
yeah, yeah.
Because that lack of estrogen or those lower levels do cause dryness everywhere, like in the
Right,
face, in the
right.
joints, but also in the vagina.
Yeah,
Um,
absolutely.
so I
And
love lubricants. I love moisturizers for the vagina. If you think about it, we moisturize everything, but we don't think about our
right,
genitalia, right?
absolutely.
Yes. I love the fact that you have a vibrator. Go, you guys, that you're selling it on Target. I think that's phenomenal. I think it's about time. So many women find something tangible, even an easier way to talk to their lovers or their partners when they have something that they can focus on. It
Mhm.
really helps them kind of bring the conversation to light, especially when they feel like there's stigma or taboo, or they feel like they're going to make their partner uncomfortable. So they'll introduce a toy or a tool, and sometimes that does make it easier. And I agree with you. The days of making everything look like a purple penis are gone. Women want
Right, right,
elegant, modern, discreet. And I think that we have every right to have that in
right.
our arsenal.
Yeah, absolutely. And I think what we also tell women, we just right now we carry just the water moisturizer, water-based moisturizer. But if a lubricant, a silicone lubricant can work really well for women. We're going to come out with another moisturizer in the next few months that's coconut based. So try different things to see what really works for you. And, don't give up if you've tried one product and you haven't, felt success. Don't give up because there are a lot of different products on the market. So,
It's very interesting that you said that because there's actually a medical study to support that women who are more open-minded and who are willing to try different things
right.
actually are more likely to have a sexually satisfying encounter than women who aren't as willing to try new things and to keep trying, right? Because the things that worked in your 20s and 30s may not work in
Yeah,
your
absolutely.
sixth, seventh decade of life. Yeah.
Right, right, absolutely. So what's next for her MD? I know you have so many exciting growth plans.
Yeah, no. So we are expanding all over the country, actually. So Indiana and Nashville, Colorado, and New Jersey
Awesome.
are going to be our new physical locations. And then we're going to surround each of those locations with telehealth. So we are rapidly growing and we're hiring physicians all over the country who are like-minded so we can treat women for menopause and sexual health.
That's great. So if any of the bold members want to check out your telehealth services, or maybe they're even in, Ohio where you're based, how do they do that? What's their first step?
hermdhealth.com, and
Okay.
there's information on how to become a patient and how to schedule a telehealth appointment and what states we're offering that in. We're also social media, HerMD Health, and also on Instagram and Facebook as well.
That's great. Well, super exciting. We need more more services like yours. So I know Womanist is so excited that you are expanding, and it's such an important mission that you're on. I mean, it's like you said, there's been a lot of things broken about our medical system. So
No, I love what we're doing together. My goal is that there's no shame, there's no taboo, there's no
right,
guilt in
right,
talking about sexuality and menopause. It honestly should be no different from a woman than when she goes in to talk about ear pain or elbow
right,
pain.
exactly.
Um, yeah, I want them to be that comfortable about menopause and sexual health. And by doing what you and I are doing about empowering and educating, I feel like we're finally giving women that voice that they have been long denied or
Right.
dismissed. Yeah.
Yeah. And I think just the younger generation is growing up with that attitude, right? That there won't be any more taboo topics. They openly discuss whether it's infertility issues or now menopause or sexual wellness in their 60s. You know, this younger generation is going to be very different. And I'm talking the millennial generation. So they need to really inspire my generation, because I'm definitely a lot older than you are. And a lot of the, you know, the participants at Bold to really just start the conversation. I mean, that's what we've really noticed. When you open it up and you start talking, then more and more people want to join in, and you know, usually it's a really inspiring conversation. So
Oh no, so many people
that's,
want to talk about it. They just need the avenue to do so.
they need the avenue, and they need to just feel comfortable, right? That they're in a safe environment. So yeah,
Absolutely.
well, this was great. Thank you so much. And we're looking forward to, you know, just inspiring more of the Bold family to tap into our products and our services. So thank you.
Thank you for having me.
I'm trying to find the end. Stop recording. There it is.
Okay, perfect.